Hi everybody, this is Gina with the Jefferson County Health Department, and tonight instead of our Facebook Live we wanted to give you kind of a behind the scenes of what our vaccine pod looks like and what to expect whenever you come through. So you're just going to come along with me as I go through.
Ready? All right, did you have an appointment today?
I do, yes.
All right, what's your name?
Gina.
Okay, and the appointment time?
3:30.
Perfect. All right, so a couple rules to go over before you go in here. Masks are required at all times while you're in the building. We also ask that you have your driver's license ready.
Got it.
Perfect. You're going to be escorted from station to station when you're in there, so don't go forward until someone comes to get you to take you to the next step.
Okay.
It is going to be a touch-free clinic today, so avoid touching anything if you can.
Okay.
We also ask that if you do have your cell phone with you, to just keep it in your pocket at all time and don't take it out until you exit the building.
Okay.
All right?
Thank you.
You're welcome. See if they're ready for you.
Okay, I'll have you step right up to our scanner. We're going to take your temperature.
Please proceed.
Okay, and then I have a list of symptoms. Just make sure you're not having any of those today.
Nope.
Have you been out of the country in the last 14 days?
Nope.
And have you had contact with someone with COVID-19 in the last 14 days?
Nope.
All right, follow me. Okay.
Yeah.
Can I have your ID,
Yes.
please? Thank you. I have Gina with me. Perfect. Just so you know, you have to wear your mask throughout the facility. No using your cell phone for privacy reasons throughout the building. If you need to use the bathroom, there's one right here.
Okay.
After you're vaccinated, you won't have access to the bathroom, so now is your chance to go. Okay. All right, you can follow me. Would you like a copy of our privacy policy or any information about the vaccine?
Sure.
Okay, grab that for you. There you are.
Thank you.
And we're going to wait until one of the nurses is available.
Okay.
Okay.
Ready?
Come on.
I can fix them. We're going to go right in here.
Oh, you can?
Okay, go ahead and have a seat. I have a few questions to ask you. Are you feeling sick today?
Nope.
Okay. Have you ever had a severe allergic reaction to something that required epi, like an EpiPen or a trip to the ER?
No.
Okay. Have you ever had a severe reaction to vaccine or any injectable medication?
Nope.
Pregnant or breastfeeding?
Nope.
Have you been exposed to anyone in the past 14 days that's positive for COVID?
Nope.
Let's see, have you received any passive antibody therapy for COVID?
Nope.
And are you on any blood thinners or have a bleeding disorder?
Nope.
Are you immunocompromised or on medication?
Nope.
Okay. What about, have you received a vaccine of any kind in the past 14 days?
Nope.
Okay.
Alright. Which arm would you like?
I guess my left.
Okay.
Alrighty.
Oh, and a timer.
Okay.
All
Awesome.
right, this way.
Okay.
Follow me.
Alright.
How are you feeling?
I'm good.
Oh, I was just wanting you all to know that this is that general area. And then
I'm going to ask that you keep your mask on and refrain from using your cell phone in the observation area.
Okay.
They will schedule you for your next vaccine while you're in the observation area.
Okay.
So you'll know when to come back.
Thank you.
So the front of the form needs to be filled out, all parts, and on the back, there's 2 places for your signature.
Okay.
You don't
And
have
that's
to
for
fill out any of the questions on the back, just sign on the 2 places.
Okay. And that's so that I can get my second dose
Yes.
appointment today?
Yes.
Okay.
Once your beeper goes off, take that right over there, and then she'll get you all set up for your next appointment.
Okay. Thank you.
You're welcome.
Okay, so we're gonna sign you up for your second dose on March 4th. Is there a certain time you'd like to come?
Anytime's fine.
Okay. All right, we're gonna put you down for later in the evening,
Okay, perfect.
and you'll get an email stating what your time is.
Okay.
All right, and you're all good to go. We're just gonna make you a reminder slip when to come back. There you are.
Awesome, thank you. Okay, so that was pretty much the entire pod, what it's gonna look like whenever you come in to get a vaccine. When we have drive-through clinics, all of those roles are gonna be the same. It's just gonna look a little different for you, because you'll stay in your vehicle. But we'll still have somebody greet you, we'll still be screening you. The whole process is gonna follow the same flow. So I still have a few minutes left on my timer. While I'm in observation, which they can see me right over there, just so everybody knows. So I just wanted to go over a couple points again that you may have missed while we were going through. These are the reminders you're gonna get. And we try to remind you at every station you get to. So always have to wear your mask. So it's very important for us, the people that are vaccinating, and everybody around you. Everybody will be wearing their mask in the vehicle or in the building, no matter what type of clinic we have. So always keep your mask on the entire time, and you'll be reminded multiple times. When we're in the building, it is for patients only. So we ask, leave your family at home, leave your friends at home. If they need to wait in the car, they can. We really only want the patient to come into the building. As you can see, we passed a lot of areas, we had a lot of hallways. In order for us to get as many people through as we can, we still need to monitor that we're social distancing within the building. And to do that is really only our staff and only the patients. There are folks that are gonna need aid. If you come with your aid to get through the building, we're gonna allow that. Remember that you're the only one that's gonna be vaccinated, only the folks that have the appointment. But for the most part, we're gonna try to keep only the patient. Make sure you bring your ID with you. As any clinic that you go to, if you go to the hospital, they're gonna wanna make sure that we can verify your ID. So make sure you have your ID, your driver's license, a photo ID with you. You've heard us say a couple of times in here, no cell phones. So for the privacy of everybody involved in this process, we're trying to limit cell phone use as much as possible. When you do your second dose, you're probably gonna need to see your calendar, we get that. But we don't want people on their cell phones recording other people, taking pictures. This is a medical procedure that everybody is going through, and we wanna make sure that we protect everybody's privacy. In the very beginning, we were asked if I needed to use the restroom. We have restrooms at the front of the building, and those are what we use for our patients. While you're in observation, we want to make sure you stay in observation, because if you have to use the restroom at that point, we're going to have to send somebody into that area with you to make sure that nothing happens in that 15 to 30 minutes. You're always going to be escorted through our building. So from station to station, you can see I was kind of handed off from person to person. We do that for your safety, for our safety, in order to keep everything flowing consistently. This is a little different than any other clinic we've scheduled because there is a 15-minute to 30-minute observation period. We can't push people through as fast as we want to and as we can. We've got to make sure we space it accordingly so that we don't overcrowd our observation area. So you will be escorted from person to person, and sometimes you might have to stand at that station for a minute until the next station is ready to accept you. We are a touch-free facility. We've tried to make it to where folks that are coming through don't have to touch door handles, walls, pins. We're trying to keep it as clean as possible for everybody. It cuts down on our cleaning time and just cuts down on any other transmission of any kind as you guys are coming through. So we're trying to keep it as touch-free as possible. So observation. With this vaccine, it's a 15 to 30-minute observation depending on what your medical history is. Please be prepared to wait that time period. So you may have to wait coming in. We know that everybody's got that same process. We're trying to run as smoothly as possible. But know that 15 to 30 minutes after the vaccine, you will have to stay in observation. And that's for your safety. That's part of the emergency use authorization for these vaccines that's written in there. So please be prepared for that. What you didn't see in that observation room, because we didn't show everybody, we do have EMS on site. So if there is an adverse reaction, we do have trained medical staff. We have our own nurses, our own nurse practitioners, but we also have EMS on site. Second dose, while I was sitting in there, they scheduled me for my next dose, so we're trying to make that as easy as possible for folks. It's very important to get your second dose, and very important to go to the same place that you had your first dose. So the dose that came in for me today, that second dose is being allotted for me and will come back here. If I go somewhere else, I'm going to be taking somebody else's second dose. So make sure you go back to the same place that you were vaccinated the first time. So we'll get that scheduled for you while you're here. And then the last reminder is for folks that even though I've received my first vaccine now, it's still extremely important to wear your mask, social distance, good hand hygiene. You want to get through all of your doses of the vaccine, and at this point the CDC is still recommending you take those precautionary measures even after you're vaccinated. So this isn't a 100%. There's still that very slight chance that something could happen. So please, everybody make sure you're still just practicing good hand hygiene, wearing your mask, social distancing. And that's it. Thanks for joining us tonight.